Hello, my name is Joan Reveles. I'm a BSN student at Florida State College at Jacksonville. I'm actually a distance learner here in Southern California, and I chose for my community health nursing project to do my presentation on U.S. Public Health Service nurses. So you might be thinking, what is a U.S. Public Health Service Commission Corps? So let me do an intro to that. It is one of 8 federal uniformed services in the United States. So you have Army, Navy, Marine Corps, Air Force, Space Force, Coast Guard, and USPHS, and NOAA, which is the National Oceanic and Atmospheric Administration Commission Officer Corps. So they are part of that uniformed services. They fall under the direction of the Department of Health and Human Services. Even though they are a uniformed service, they are not considered part of the armed forces. So as you can see here, they're classified as non-combatants, which means they don't receive any weapons qualifications training in their initial officer school, unless they're directed to serve a branch of the military by the order of the president, or if they get assigned to a military base, such as here in Marine Corps Base Camp Pendleton. Now, as you can see, they were founded in January 4th, 1889. As far as the spectrum as to when they were established within the armed forces, you have the Marine Corps, which was established in November of 1775, and the Air Force, which is all the way in September of 1947. So smack dab in between, a little over 100 years after the Marine Corps was established. The government saw the need of public health that needed to be addressed. So they created this corps, this health service. They are one of 2 uniformed services that consist only of commissioned officers. There aren't any enlisted. So the basic minimum requirement to be a commissioned officer is to have your bachelor's degree. And I'll go into that later as far as education requirements. And you can see the primary mission of the USPHS is the protection, promotion, and advancement of health and safety of the nation. So going into U.S. Public Health Service nurses itself, they're actually one of the largest communities within the public health system or public health service. There are in total around 6,000 PHS officers. Of the 6,000, 1,300 are commissioned nurse corps officers. So that's roughly a sixth of their entire community. So as you can see here, their primary responsibility is to ensure and promote the public health and safety of the American people. And their primary activities are solely based on their role capacity. For example, you can have a PHS nurse working as a staff nurse at a naval hospital assigned with the U.S. Navy. In that case, since they are assigned with the U.S. Navy, they are considered combatant. But they are working at a naval hospital in that role capacity of a staff nurse. You can also be a nurse practitioner working at a clinic at an Indian reservation, or if you're further along in your education, you could be working on your doctorates and doing research for the National Institute of Health or the CDC. So the spectrum is so vast as far as their roles and activities. Again, this is a list. This list is so vast as far as potential work locations as a USPHS nurse. If you take a look here, you have Federal Bureau of Prisons, the FDA, the Indian Health Services, NIH. You could even be assigned to a national park. You have U.S. Department of Education, in which you could be working in a school nurse capacity. You have, what else here? You have the Department of VA, so you could be working at a VA hospital as well. So that just goes to show how vast the work locations are. Aside from that as well, you can also be deployed into certain areas of where relief efforts are needed as well. Like for instance, you have hurricane relief efforts in Florida, wildfire and earthquake relief efforts in California. A huge one is when 9/11 happened. So you have these nurses responding to all these different kind of responses. Virus outbreaks like Ebola, and most recently, they responded to COVID outbreaks as well. So as far as necessary skills and abilities, they provide direct patient care, and these are within the locations, like I said, Indian Health Services, National Health Services, NIH, through Immigration, Federal Bureau of Prisons. So you need to have that basic working knowledge of patient care, things like vital signs, medication administration, IV infusion, things like that, especially having to know what their chief complaints are and having to figure out a plan as to what their capacity is as far as moving towards a positive patient outcome. They can provide supervisory and consultative nursing expertise. So different agencies like the CDC, Center of Medicare and Medicaid Services, the FDA or the Food and Drug Administration. Also, they can provide research and identify certain solutions through other PHS agencies as well. Places like the NIH or the National Institute of Health. So it's very important to go into as far as the basic eligibility requirements for initial application into the USPHS. So the bare minimum, you need to have a BSN degree with a cumulative GPA of at least 2.8 on a 4.0 scale upon graduation. You need to be a US citizen. You have to be under 40 years of age unless granted a waiver, which in some cases in other communities, those are granted based on the various needs of that community. You have to also possess an RN licensure in the home state in which you're applying to. All right, and then as far as educational preparation, like I mentioned before, you need to have a Bachelor's of Science in Nursing and hold your current RN licensure. That's like the bare minimum requirement. Or you can also be working on a Master's of Science in Nursing as well, and that can also facilitate more nursing research opportunities and teaching opportunities as well. Other disciplines or professionals that they can interact with: doctors, PAs, RTs, HCAs, LCSWs or PTs. All of these different roles or different disciplines. It just all depends on where they're located or where they're stationed at, or even where they're deployed to. So say, for example, if they respond to a certain virus outbreak, they can easily be working with doctors, physician assistants. Especially with COVID, they definitely worked with respiratory therapists. So it just all depends on where they're assigned to. Again, teaching and learning strategies vary based on assignment. For example, I'll throw in an example. So say, for example, a clinic at an Indian reservation. You really have to know and get to understand and practice cultural competency when it comes to Native Americans. some certain characteristics of American Indian communities. They value close family relationships, very small communities. They have very strong spiritual beliefs, so you have to be mindful of that and take that into consideration prior to providing healthcare services for them. Sometimes they can be leery of certain outside organizations that come in onto their reservation. They might have that sense of mistrust, so it's very important as a nurse to establish that sense of rapport, that trust, that you are there to help them and encourage them to have a better health. They also believe that body and soul are one, that health is synonymous with the harmony and body of soul with nature. So that's just an example as far as teaching and learning strategies. Again, it would have to tailor towards where they're assigned, like military base or even at a prison. So really you have to get to know your patient population. And lastly, I have something unique, interesting that I learned about this nursing role. Again, I can't stress enough as far as the versatility of USPHS nurses. Like I mentioned before, there is that vast list of different places that they can be assigned to. And in fact, that the individual has that input. They can say exactly where they want to work and they'll work with you as far as making that happen. Their deployments, so say for example, they go respond to a wildfire or a hurricane in Florida. Those deployments are a lot shorter than regular military deployments. You're looking at maybe 1 or 2 months as opposed to 6 months to 1 year as far as regular military deployments. So that's pretty neat as far as their rotation is a lot more efficient as far as deployments are concerned. And on top of that, they have the same pay, the same benefits as active duty officers. So the rank structure, 01 to 010, they get the same exact pay, and they get the same exact housing allowance, food allowance, things like that. So, I mean, in retrospect, being a USPHS nurse is a pretty good deal, and I feel like more nurses straight out of school should know about this opportunity, that they can also serve their community in this capacity as well, just as a bigger picture and having to protect and serve the nation by providing that health care. So that's all I have. Thank you.